Welcome to this Thursday edition of the Chiefs, and with us right now are Ana Marie Pamintuan of the Philippine Star, Lucy Cruz Valdez, the head of News 5, and in a little bit, Robbie Alampay of One News. I spoke too soon. Ami's not yet there. But Robbie should be coming online soon.
Yeah.
Well, happy Thursday. We're over the hump.
Yep. At malapit na ang favorite ko, the weekend.
Okay. It's really hard to tell when you work from home. Before kasi you could tell the day by the traffic. Mondays and Fridays are bad. Wednesdays are are iffy.
Yeah. Oh, anong balita?
What's the big story today? Well, in the past 2 days, a lot of questions in the Senate over the proposed budget for 2021. Among them, yung budget ng National Task Force on Ending Local Insurgency, which is NTF-LCAC, na 16 billion. And then today naman, it's bigger than some departments, budget. And today naman, flood control projects worth 150 billion pesos, a budget bigger than even that of the Department of Health.
Grabe, no? Kasi yung Department of Health, 120 lang yata,
Thereabouts, 120, 130. Yeah.
150, supposedly, here. No?
So, mas malaki pa siya, mas malaki pa yung budget ng flood control versus for example Department of Agriculture na wala pang 100 billion or Department of Transportation na 147 billion I think is the proposed budget. So interesting questions lang. But of course, one question there is what kind of flood control projects are we talking about? Kasi if they're hard infrastructure projects, that's one thing. Kasi those projects will stay. Pero in the past, kasi we've seen hundreds of millions of pesos being devoted to what we call dredging projects.
Yeah.
Which is needed din naman kahit paano. Pero if it goes uncontrolled, you're spending hundreds of millions of pesos just moving sand from one part of the river to the other. And it never ends.
Yeah. Well, even as we're talking about that.
Well, Robbie's online.
Of course, the Dolomite project still goes on. No? So parang all of these come into play. Di ba? When you're talking about flooding and then you see the Dolomite, transfer in Manila Bay. Wow. Okay. But that's another...
they're saying the DNR is doing a second study on the Dolomite project because of the protests. So they're reconsidering.
But tama yung punto ng environmentalist doon. That's fine, that's welcome, but let an independent body, an independent group conduct the new study and the new research.
Well, welcome, Robbie, and of course down there is Ami Pamintuan of the Philippine Star. Ami, what's your big story that's coming out tomorrow?
Puro Pemberton kanina yung mga story. Pinirmahan na daw yung nakarating na sa Bucor yung
nakarating na
yung pardon, and pinirmahan na ni Bucor chief, kaya pwede nang i-turn over sa Bureau of Immigration. So by weekend baka pwede nang umalis si Pemberton.
Tapos baka nga bukas pa lang If you remember, si Daniel Smith, it only took him 2 days from the reversal of the Court of Appeals to his flight to the US.
Yun yung original na sinabi ng lawyer, di ba? By Friday, probably, baka nga pwede nang umalis. Kasi military plane naman yata mag-aalis dyan
In the meantime,
siniswerte yung mga prisoner doon, mga 86 na napalaya ngayong araw. 86. On pardon. Parol. Mga 90 sila actually, 90. Almost 90.
In the meantime, isang interesting kay Pemberton is as we were discussing, si Presidential Spokesman Harry Roque already gave his thoughts on this. But it was interesting, I thought. We expected him to defer to what President Duterte had decided. But he also, I don't know the exact words, but he also tied it to, pero kung ang kapalit naman nito is kung magkaroon ng vaccine galing sa US, we are guaranteed na tutulungan din tayo ng United States. It wasn't quite a categorical linking, but I thought it was interesting to bring in that context.
Yes, right. I wonder how.
Yeah, but
I wonder if that's just pure speculation or meron siyang napipick up talaga na ganong drift, no? You wonder
yeah.
Diba, parang medyo layo, pero baka rin na rin.
Okay, but the point is, he certainly did not have to say anything like that. All he had to do was to just defer to the president. That's what the Department of Justice has been doing, and other officials that have spoken out have just simply said, look, that's the prerogative of the president. This is what he's citing. Sinabi niya wala naman daw nagsabing bad conduct yang si ano. And so they just defer to the authority and the prerogative of the president. This context that was raised certainly was unprompted.
Yeah.
Mukhang out of the
Yeah,
loop
but
naman
that's part
si
of his
Harry
job
Roque
to make it look
dito.
like it's in the national interest.
Pero mukha namang out of the loop siya doon. Saka sinabi naman nag-tweet kagad si Teddy Boy Locsin na na hindi daw, wala daw, no exchange. No
Yeah.
exchange. But it's interesting na pati yung pag-release kay Pemberton na-relate sa COVID problem natin.
Oo nga. I smell a segue coming.
Balik tayo ngayon sa ating pinakamalaking problema pa rin, the COVID pandemic, and that's our guest, Ed.
Yeah. Our guest for tonight is somebody you probably see on TV more than you see us.
Yes. Morning, noon, and night siya.
Oh, talagang she's gotten the hang of it already. I mean, how many months now? Since March pa, di ba? April, May, June, July, August. Oh, going half a year.
Yes.
So,
Let's welcome her na, Gabe.
sige, napapahaba tuloy. Our first guest for tonight is of course Health Undersecretary Maria Rosario Vergeire. Mama Usec Vergeire, maraming salamat po for joining us tonight.
Opo.
Good evening,
Good evening po.
Good evening po.
Good evening to all of you.
Yes.
Good evening po. Ma'am, si Secretary Anyo, Interior Secretary Anyo announced, I think it was only yesterday, na they will be tightening the rules on isolation or quarantine or quarantine of those who are positive, including home quarantine specifically. Before kasi may mga exemptions pag asymptomatic or mild symptoms, pwede ka mag-home quarantine if you have the bathroom, if you have your own room, and so on down the line. And Secretary Anyo saying, no, they will crack the whip. Malamang wala ng exemptions possibly by this week. Ma'am, we'd assume, of course, that this was also, of course, through the DOH. What will happen now to everybody who is quarantined at home? They will have to be surrendered to isolation facilities.
Well, nothing is final yet. Actually, I just came off from an IATF meeting and it was discussed there. And it was agreed that it would be further studied. But I just like to give that information where the National Task Force and even the ILG, that's I'm coming from why Secretary Anyo and Secretary Galvez are proposing this, because they see it in the ground when they go to the different areas that the home quarantine conditions of people who are doing this are not really conducive and not compliant to what is the existing protocol as of now or currently. So ang sabi nyo nga po, kailangan may sarili kang banyo, kailangan may sarili kang kwarto, kailangan wala po kayong vulnerable na population sa inyong bahay. So marami pong hindi nakaka-comply. That's why they are recommending that. But of course, it has to be agreed on. It has to be further discussed in IATF. We will wait for the decision of the IATF on this.
Ma'am, so hindi po policy. Kasi the impression that he gave was that by this week, this will be in place.
Well, it was discussed a while ago in IATF, and the agreement was it has to be further studied. But of course, we are looking at this and it has to be immediate because if it's going to be implemented, kailangan po nating i-orient din ang ating mga local government units. So pag-uusapan pa rin po, wala pa hong final.
Usec, ilang araw nang sinasabi to ng DILG na yun ang gusto nila actually Si Secretary Anyo, si Secretary Galvez. Pero consistent din naman yung DOH na hindi complete na matutuloy, na meron pa rin pagbibigyan. Ano po yung pinakamalaki niyo bang reservation on your part kung magiging complete na na hindi na ipagbabawal na yung home quarantine? Ano ba yung inaalala ninyo doon?
Well, unang-una, it will require resources kasi kailangan po yung ating mga facilities would be enough and adequate for everybody who will be identified as mild and asymptomatic to have these facilities. facilities to do that. Second, hindi lang naman ho facilities, kailangan po natin ng health human resources kapag ka po nagkakatay tayo ng ganyan. Pangatlo, yun pong ating resources para pakainin po at isustain na natin ang mga ilalagay natin sa facilities. Kaya nga po lahat ito pag-uusapan at ang magkakaroon po ng desisyon ng IATF. Gusto ko lang klaruhin, meron naman pong nangyayari na ngayon na ganito, no? Ito pong tinatawag natin na Auckland Kalinga. Ginagawa na rin naman po yan, in-inspect na po ng NTF, in-inspect na po ni na Secretary Anyo, yung mga kalagayan ng ating kababayan. At yung pong mga nakita na nila, na-encourage po nila na lumipat po sa temporary treatment and monitoring facility. So nagagawa naman po, kaya lang kailangan lang of course maging formalized, kailangan makapag-usap-usap din po ang mga bawat ahensya, at saka kailangan handa ang gobyerno.
Okay. Now, in the
Bakit po naisip gawin ito? Gayong sinasabi na nga po ng projections ng UP Octa na nagpo-flatten na. Nakakakita po ba ng mga senyales na mukhang kumakalat pa rin, lalo na sa mga kabayan? Yun po ba ang dahilan?
Well, Lucy, we need to differentiate this, no? Because what UP Octa research group has issued would be, they said that apparently there is this flattening of the curve. Ito pong nakita ng ating National Task Force at saka DILG, nung sila naman ay constantly nag-iikot, nakita nila talaga po na yun pong home quarantine na ginagawa ng ating ibang mga kababayan, hindi po nagiging appropriate. Kaya po nakikita natin na ito ay isa sa contributing factors why there is community transmission. Yan po yung isang notation dyan, observation po yan. Kaya inaaktuhan po nila ng ganyan. And that is why there is this recommendation. Now with regard to the UP Octa Research Group, na pinalabas po nila na apparently the curve flattening, kailangan maintindihan po ng ating mga kababayan. When we talk about flattening the curve, this means spreading the number of cases into a longer period of time so that our health system will not be overwhelmed. Pag tinignan mo natin ang mga indicators na ginagamit dito, yung transmission rate, dati po 2 to 3 tayo, ngayon po 0.87. Pangalawa, case doubling time, dati less than 7 days, mabilis magdoble ang kaso. Ngayon po, nasa more than 10 days tayo. And case mortality time, ganun din po, more than 10 days. Pag tinignan natin yan, magandang indikasyon para sa atin yan. Pero ang sinasabi na din po ng ating mga eksperto, kailangan pa natin pag-aralan ng mas maigi. Dahil in spite of these advances or these successes na nakikita natin na slowly nakakaagapay tayo, meron pa rin po tayo nakikitang mga numero ng kaso na nandyan pa rin po siya, no? Hindi naman po siya nakikitang bumababa the trend of cases. We have to remember, the reports that DOH publishes every day is reliant mostly from our disease reporting units. Ibig sabihin po, lahat po ng i-report namin sa inyo araw-araw, manggagaling po yan sa sinasubmit sa amin ng aming mga laboratorio, ng ating mga local government, ng ating pong mga ospital. Kapag kung halimbawa, in a given day, 70% lang ang nag-submit ng laboratories ng ating mga reports, ibig sabihin 30% na hindi na-report. And that is what's happening right now. That's why you see our numbers are not really parang constant or stable. Minsan 3,000, minsan 4,000, minsan naman 1,000 plus lang. Kaya nga po amin pong ina-address yan sa ngayon through this system that we have and also enforcing more sanctions to these disease reporting units para po maging kompleto ang ating reports at mga kaso.
Ma'am, speaking of other indicators that we're looking at, lalong-lalo na specifically kung nakaka-cope ba ang ating public health facilities. Sa DOH website po, nakalagay ang bed capacity as of September 8 is at 45.9%. What does that tell us about our capacity right now? Is it improving?
Well, if you compare it with the previous weeks, no, I give you a specific example. In the National Capital Region, before we had the MECQ that was requested by our healthcare workers, we were hitting about 80-81% in our critical care utilization. But right now, we have 65%. So pag tinignan ho natin yan, nakakaagapay tayo slowly, but surely we are being able to decongest our hospitals. We are being able to rationalize how we admit patients, kung sino lang ang dapat sa ospital at kung sino po dapat ang nasa temporary and treatment monitoring facilities. So pag tinignan po natin, nag-i-improve po yung ating capacity for the health system, but we are not saying that we are out in the woods na hindi na safe na po tayo. Pag tinignan ho natin yan, sa warning zone pa rin tayo. Kaya nga po patuloy ang paalala natin sa ating mga kababayan, in spite of these improvements, kailangan pa rin po mag-continue tayo dun sa ating minimum health standards.
Ma'am, still on capacity, kamusta po yung take up sa panawagan natin for more health workers, specifically more nurses and doctors to take up our human resource? Kamusta po yung emergency hiring natin?
Yes, we have this emergency hiring, and since we have strengthened it, no, as of now we have already hired almost 8,000 no na mga workers, but that is still lacking kasi ang target po natin at saka ang available natin ng mga plantilla na posisyon na ibinigay para dito sa emergency hiring would be almost 10,000 plus. So kulang pa rin po, kami pa rin po ay araw-araw na nananawagan para po tayo ay makakuha pa ng additional health human resources.
Ma'am, yung lag time sa reporting, bakit parang matagal na po nating problema yun, ano? Ano po ba ang dahilan at hanggang ngayon, may kabagalan pa nga rin po yung actual pag-report ng mga results from the testing centers?
Yes, ma'am. Actually, this is one of the biggest challenges of government. No, ito pong ating pag-report na ganito kasi nanggagaling nga po mula sa pinakababa hanggang sa taas ang ating reporting. Ibig sabihin, from the barangay to munisipyo, kaya nga po nagtayo tayo o nag-establish tayo nitong sistema, yung COVID Kaya. Dati po, ladderized approach tayo. It comes from the lowest form hanggang sa taas. Ngayon po, this COVID Kaya, pag nagpasok ka ng datos, lahat na tayo makakakita niyan, lahat na tayo makakagamit niyan. Unfortunately, not all LGUs and not all disease reporting units are using COVID Kaya. Pero pag tinignan naman natin, comparing to before, no, tumaas-taas naman po ang utilization na rin natin coming from our disease reporting units, but still not complete. Pangalawa po, meron po tayong ang reason kung bakit po tayo nagkaroon ng ganitong delays sa ngayon, it's because nagkaroon po tayo ng dalawang variables na ginawa nating mandatory field dyan po sa ating reporting. And that is the complete address of the individual identified as positive at saka yung contact details. Kung matatandaan niyo po, nagkakaroon po ng issue at saka nagko-complain ng local governments. Bakit daw ang bagal ng DOH magbigay ng datos? Kulang-kulang pa. Hindi po nila makontact trace agad. So it was because we are reliant from these disease reporting units. Pag kulang ang binigay nila sa amin, kailangan pa namin balikan agad. Pero ngayon, ginawang mandatory yung field. Ibig sabihin, hindi nila makukumpleto ang pag-upload nila sa COVID Kaya kung hindi nila kukumpletohin lahat ng detalye dyan sa hinihingi sa kanila. Kaya po nagkaroon tayo uli ng lag ngayon at hindi makasubmit yung iba dahil ina-align pa lang po yung kanilang mga sistema with this two mandated variables na bago po.
So it's just a matter of them actually getting into the system para pare-pareho yung pinanggagalingan ng data. Ganun lang ho ba yun? Kasi kung if it were just a matter of filling up the fields, hindi ba matagal na pong ginagawa yun? So hindi ko lang maintindihan bakit hanggang ngayon yun pa rin ang problema. So it's just the software perhaps? Ganun ho ba yun? Iba-ibang software ang ginamit or iba-ibang tables, kumbaga, of reporting?
Well, maraming challenges dyan, ma'am. Unang-una, itong fields na ito, fini-fill outan po ito, no? And this should be, ideally, it should already be complete coming from the originating source before it gets to our laboratories. Unfortunately, when it gets to our laboratories, hindi pa rin kompleto. So ito pong ating mga medtech, yung mga gumagawa ng test, pagkatapos ng lahat ng gagawin nilang proseso, sila pa rin po ang magagawa at magkukompleto niyan. So that is really a bottleneck for us. Kaya nga po ngayon, nagkakaroon po tayo ng mga bagong polisiya at hinihikayat natin ng mga laboratorio. No? Kapag hindi kompleto ang inyong case investigation form na ibibigay sa inyo ng mga disease reporting unit na nagbibigay ng specimen, huwag na pong tanggapin para po magkaroon tayo ng discipline na from the originating source, kompleto na po ang ating detalye at konti na lang po ang idadagdag ng ating laboratories. Hindi na rin po sila mahihirapan. So we're slowly trying to address this. Actually, when we started doing this quality data quality initiatives. Dati po, porsyento na kulang ng walang munisipyo, walang barangay, walang contact numbers. After 2 weeks to 3 weeks of implementing this strictly, 0% po. Ibig sabihin, wala na po kaming nakukuha na kulang. Hindi na po mapasok din sa sistema namin. So nagagamit na po maigi ng local governments for contact tracing.
Usec,
Given the
lilinis na akong
bottleneck,
konti.
nung Tuesday nga, I think you only had 2/3 of the laboratories reporting the results. Out of 115 laboratories, only 81 submitted. That's basically 2/3. Given the fact that you have a bottleneck, would you expect an artificial surge in numbers when the numbers catch up?
That's right, sir. And we would want, actually, we're priming people already. We presented to IATF a while ago so that everybody will be informed. Kasi nga po, marami pong nag-iisip, bumababa daw ang mga kaso, 1,000 ng isang araw, 2,000 lang. Pero sinasabi ho natin, this is a function of reporting. So kapag ka naayos na po ng mga kanilang laboratorio ang kanilang mga datos at nag-submit na po sa atin, madadagdag po yan bigla dun sa mga numero natin at magkakaroon nga po tayo nitong additional number of cases.
But given that, ma'am, would you say that the transmission rate, the positivity rate, would they still be accurate given that there's a significant lag in the numbers?
Well, the positivity rate is a function also of testing, no? So kapag ka po nadagdag po yan, maaari din po, no? Kasi mga positive cases yan, maaari po maka-apekto yan doon sa ating positivity rate. So we will see, we're trying to analyze all the indicators now and we're trying to prime po kung paano natin ipapakita yung messaging natin sa mga tao para naman po hindi nagpapanik, ano? Para naman po naintindihan nila na ito po ay bunsod lang ng hindi pagkakasubmit ng report at dahil inayos nga natin ulit itong mga variables para po atin pong magawa ng maigi ang contact tracing.
Usec, in the meantime, the holidays for the dead are approaching. Is this a cause of concern for the DOH? Kasi kahit sinasara na ang mga mayor ngayon yung mga sementeryo, yung mga tao nag-uumpisa na rin magpunta ngayon dun sa mga sementeryo. Inuunahan na nila. Meron ba kayong mga suggestion to IATF para sa halimbawa crowd control, physical distancing? Have you started talking about it?
Well, it's basically the same, ma'am. No, whatever minimum health standards we employ right now, should still be applicable, no, when that time comes na dumating po yung ating undas. Pero po, syempre, pag tinignan natin yan, mass gathering po yan. Kaya nga po kami ay natutuwa. Nagpalabas po si Mayor Moreno ng City of Manila. Nauna po siya, nagkaroon po siya nitong order na talagang isasara niya po ang mga cemetery sa Manila during this time to prevent mass gathering at makapunta na po unti-unti bago dumating ang panahon niya. So siguro kung magkakaroon kami ng rekomendasyon, we will align to this recommendation of the good mayor in Manila because I think this is laudable, no? Kasi po dito po maiwasan po natin yung talagang pagsisiksika ng tao.
Ma'am, speaking of Manila, ma'am, medyo maiba lang ako ng konti, samantalahin ko lang po. What exactly is the DOH insight and stand when it comes to dolomite dito sa Manila Bay?
Well, as you have mentioned, no, and we have issued already a statement on this na ang sa amin, unang-una, once this is cleared by the Department of Environment and Natural Resources, it means that it will be safe for the environment and safe for the population. Pag tinignan mo natin ang mga artikulo at saka mga studies regarding this specific, yung dolomite nga po, sinasabi po dyan that if it is already processed, it doesn't have any health hazard anymore. But during the time that you process it, like you crush it, dun po nagkakaroon ng mga respiratory adverse effects. So kapag ka mga ganyan naman po with this kind of industry, nakakasiguro naman po siguro tayo because yung mga laborers natin na gumagawa niyan are usually equipped with their own PPEs for the industry.
Okay,
Ito lang po yung sa antigen. Hanggang ngayon po ba, hindi pa po tanggap ang antigen test as a standard for testing. Kasi parang marami pa rin po ang hindi nagsusubscribe sa antigen. What's the stand of the task force on this?
Yes, ma'am. We are currently studying it thoroughly. Actually, meron na ho kaming draft for that. We just discussed this with IATF. Naaprubahan naman po iyan. Kailangan lang po ng final na guidelines na lumabas para po we can guide the implementers or those who's going to use it when antigen is when antigen is appropriate to be used, paano gagamitin, sino po ang pwedeng gamitan. Yan po ang ilalabas ng Department of Health na protocol. But ngayon po, masasabi po natin, meron na ho tayong guidelines for that and it has already been approved by the IATF. Pero may mga condition lang po na pwede natin yan gamitin. At yan po ay base sa siyensya na pinag-aralan ng ating Health Technology Assessment Council. So maybe by next week, we can already issue the guidelines. Once approved, again, we will present to IATF. Pag naaprubahan na yung final pathways natin, we can already issue the guidelines.
Can you share with us some of the conditions para katanggap-tanggap ang antigen?
Oh, well, antigen testing, ma'am, unang-unang kondisyon, kailangan yung registered by FDA. Sa ngayon po, meron ng 8 antigen test kits na rehistrado ng FDA. Pangalawa, kailangan it's locally validated by our National Reference Laboratory, which is our ITM. And currently, they were already able to finish validating 2 of these 8 antigen test kits. Pangatlo, kailangan po makasunod sila dun sa diagnostic performance na nire-rekomenda po ng ating Health Technology Assessment Council, and that is the sensitivity and the specificity of this test kit. So kailangan 80% or more or higher na sensitivity and more than 95% specificity ang magagamit na antigen test kits para magkaroon ng accurate test results. Pangapat po, sinabi ng Health Technology Assessment Council natin, hindi siya pwedeng gamitin para sa indiscriminate testing. Ibig sabihin, kahit sino na lang pwede. Kailangan po targeted testing pa rin. So, ang ginagawa ho nating guidelines ngayon ay ito po ang makakapag-guide dito po sa mga gumagamit nito kung paano gagamitin at kailan siya dapat gamitin.
Ma'am, merong private company na nagdala dito ng Avigan under a special permit daw from the FDA. Ginagamit na ba siya rito for treatment or for intervention in COVID cases?
Well, ma'am, if we talk about the clinical trials for Avigan, it has not started yet. We are still finalizing the official documents that we will use for this. Pero po sa compassionate special permit na sinasabi, yung kinuha po sa FDA, nagagamit po yan ng mga pasyente sa ngayon. At ito po ay kailangan lang na meron kang permit from the Food and Drug Administration for the patient to be able to receive this.
So we are using it already?
Yes, some patients are using it already based from the permit that is being issued by the Food and Drug Administration.
Okay. You need siyempre prescription drug yon.
Of course, it has to be that the doctor would be applying for the use of this Avigan to FDA, and then the doctor has to attach the informed consent of his patient for this use.
Sino
Just to be clear, it's only for treatment. No, it is not a cure. There is no cure pa naman. It's only for treating symptoms.
Intervention.
No cure yet for COVID-19. All of these off-label drugs are being tried, pero wala pa hong nabibigyan ng ebidensya na sapat para sabihin na ito talaga ay makakapanggamot sa COVID-19.
In the meantime, habang ini-administer siya, are you monitoring the effects on the patients? Kasi parang ang dami-daming dinala ng kumpanya dito na drugs eh.
Of course, ma'am, that's part of the condition. So we have this post-marketing surveillance that we do. This is a surveillance for adverse reactions or whatever benefits. So kahit hindi po siya kasama sa clinical trial, yan pa rin po i-monitor na maigi ng ating Food and Drug Administration. At may responsibilidad po ang mga ospital at mga doktor na gumagamit niya na mag-submit ng report sa FDA na regularly para po monitor ng FDA itong paggamit nito.
And the patient needs a consent. Do you require a written consent from the patient?
Yes, definitely, ma'am. Yes, ma'am. For every medicine that we try out na wala pa akong proven na effectiveness, ito po ay hinihingi natin sa ating mga kababayan na pasyente.
Ma'am, last na lang para sa TV5, yung facilities namin. Ma'am, is it possible na Pag merong nag-positive, hindi po ba pwedeng a certain portion lang of the facility will be shut down? Kailangan po ba talagang yung buong building, yung buong facility i-shut down? Hindi po ba? Yeah, may kahigpitan lang po yung shutdown requirements ninyo. With Dole.
Well, I think DTI and Dole are discussing that right now, currently, no, para po pag-aralan itong naging provision na ito dun sa kanilang guidelines. Pero pag tinignan naman po natin, base sa mga protocols natin, pinapayagan naman po yung compartmentalized lockdowns. Ibig sabihin, halimbawa po, 5 po yung floor ng inyong building. Doon lang po sa second floor nagkaroon ng may sakit, tapos enclosed naman, at hindi naman apektado yung ibang lugar, maaari naman kung yung floor lang na yun, pati yung common areas on that floor. So mapag-uusapan po yan. Sa tingin ko, ngayon po, ang pagkakaalam ko, pinag-aaralan po ulit yan para makapagbigay tugon doon sa mga humihingi po ng apila o umaapila dito sa ganitong guideline.
So wala pa pong final decision on it?
Iyan po ang pagkakaalam ko kasi yan po ay nakapaloob doon sa DOH DTI guidelines. Dole and DTI guidelines. I'm sorry.
Okay. Salamat.
Okay. Maraming salamat, ma'am. Undersecretary Maria Rosario Vergeire, ma'am, thank you very much for joining us tonight.
Thank you po.
Salamat po.
Nothing pa rin,
Sorry,
Chief.
Pasok na kayo. Balik na kayo sa studio na. Balik na sa studio, Ed.
Para matapos.
Ay, okay lang. Mahirap ang trabaho sa bahay. Hindi may aso tumatawag.
Akala ko pupunta. Kung
Balik sa
magtanong to,
studio.
akala ko pupunta.
Kayong dalawa, balik na sa studio.
Oy, teka, mag-gap daw tayo. Baka paalisin tayo. We'll just go into a break, so please stay with us.
Mayor Toby, standby na po tayo.
Welcome back to the Chiefs. We are now in the final stage of our conversation. And now joining us is the Mayor of Navotas, Toby Tiangco. Good evening, Mayor. Mayor Toby.
Yes, good evening, Ami.
Welcome back to the Chiefs.
Yes, good evening.
Yes,
Hi, sir.
Nandiyan pala si Lucy,
Mayor.
Robbie.
kompleto po kami.
Pero,
Yes.
Okay.
parang nan-lead kayo sa amin.
Oo nga.
Parang
Ano ba?
Oo,
Hindi ko kasi
Hindi ko hindi ko maayos yung auto-rotate nung phone eh. Bumabaligtad yung picture pag...
Ganito. Mayor, pinag-usapan namin yung home quarantine eh. Kanina medyo
Okay.
gusto ng DILG completely wala nang home quarantine. Sa Navotas, di ba medyo mahigpit din guys sa quarantine. Ano ba yung rules in your city? Saka anong sitwasyon ngayon? Kayo yung
ever since
matagal
ever since the beginning, we did not allow home quarantine. Actually, pag nag-iikot yung IATF, they asked me to make a video I think, a 5-minute video to explain how we did it in Navotas, yung bawal ang home quarantine. At yun yata ang pinapakita na sa bawat LGU because they requested me to make a video. So I think ngayon, based on sa pronouncement ni Secretary Anyo, it's going to be an official policy already, no? Pero
Actually, sir,
kami, everything, yeah.
sir, we were just talking to Usec Vergeire, nag-usap daw yung IATF kanina, wala pang policy, pag-uusapan pa lang nila. So mukhang hindi pa siya go.
Kasi kulang
Okay,
daw ng resources, hindi daw kaya ng gobyerno. Hindi daw kaya ng
But sa Navotas, hindi talaga kami pumapayag ng home quarantine, no? Actually, this is how it's done, no? Every day at 6 p.m., nagmi-meeting kami. Nandun yung City Health, nandun yung buong interagency task force, no? And then, ipapakita isa-isa kung sino-sino yung mga nag-positive at yung mga close contacts nun. And then, yung mga close contacts na handun lahat ng barangay captains, there are two things we ask them. Number one, yung close contacts kahapon, kung nadala lahat today. Pag hindi nadala, they have to explain why. Pag sinabing, ito, nag-refuse, papagawan ko na yan ng letter kaagad sa City Legal, kaya nahandun din yung City Legal. The next day, dadalhin sa kanya yung letter na explaining why he cannot refuse. Pag nag-refuse siya, mapipilitan siyang imbitahan ng pulis, no? Luckily naman, pag pinapakita yung sulat, wala namang nagre-refuse na. Sa tingin ko, on the first day, baka na-shock lang sila or kaya medyo nagre-refuse, no? And then, ganun, tuloy-tuloy lang yung cycle na yon. So, dadalhin sila sa swabbing namin, sa local swabbing. Meron na kaming local swabbing na ang capacity is 1,000 per day. And then, isoswab sila doon. Habang nagsuswab sila, meron ng preliminary contact tracing doon. Dala na nila yung form kung sino yung mga naging close contacts nila. So that just in case na mag-positive sila, meron ng pagsisimulan doon sa close contacts nila. And then, pag naging positive ulit sila, ulit na naman ganun ulit sa close contacts. So hindi kami pumapayag na yung mga close contacts ay hindi maswab at hindi rin kami pumapayag ng home quarantine as a general rule. Pero sinasabi ko nga may exemption dyan kasi breastfeeding mom, yung disabled na hindi niya kaya maglakad mag-isa, yung super senior, kunyari 80 years old, yun, mga exemptions yun. No? But konting-konti lang yan.
Maybe linawin ko po, ang basis natin for saying that somebody is going to be told or encouraged or reminded or ordered even na hindi mag-self-quarantine. Ang pagpapasiyan nun is yung swabbing at saka yung contact tracing.
Yung swabbing. Yung swabbing is the basis for bringing you to the community isolation facility. Yung mga close contacts naman, lahat ng linistang close contacts, you cannot refuse. Hindi mo pwede sabihin, ayoko magpa-swab. Hindi pa pwede yun. Pag nalista kang close contact, kailangan mo. So there are dalawang beses ka hindi pwede mag-refuse. Kung positive ka, hindi ka pwede mag-refuse na dalhin sa community isolation facility. Kung close contact ka, hindi ka rin pwede na mag-refuse na magpa-swab, no? Ngayon, ang loophole diyan, may loophole pa din diyan eh. Kasi sa dami ng sinaswab, hindi naman nababantayan ng barangay captain yung mga o ng barangays yung mga swinab kasi dapat yung swinab they will not go out of the residence hangga't hindi sila nagne-negative. So yan, may loophole diyan. Kaya dinadamihan namin yung community isolation facility namin kasi pag natapos yung community isolation facility namin na dagdag na 150 beds sa Navotas, we will further improve it. Ang gagawin namin is pag-swab, punta ka na sa community isolation facility. Pag nag-negative ka, tsaka ka uuwi. Pag nag-positive ka, ililipat ka namin sa ibang community isolation facility para yung community isolation facility within Navotas ay para doon sa mga nag-iintay ng test. Yung mga positive, outside Navotas na sila mag-CCIF.
So, wala nang nagse-self-quarantine. In effect, wala na.
Ever since before, hindi talaga kami pumapayag. Ang pinapayagan lang nga namin, yung mga exempted na ganon, tsaka yung mga frontliners na may sariling banyo, may sariling kwarto. Yung frontliners, lalo na yung medical frontliners, there is a reason. Because they might have contracted the disease in the line of service, in the line of duty. So parang parang konting konsuelo na lang sa kanila yon.
So
Yung hindi man lang nagpa-swab, yung may nararamdaman ako, nasa bahay lang ako, iniinda ko, ayokong aminin kahit kanino, mild naman. Is that a loophole or meron din tayong mekanismo to check on that very human instinct?
Hindi, kasi pag ganon, pag report ka ng BHW na may symptoms ka, pupuntahan ka and they will tell you to swab. Pag suspect ka, suspect yung tawag dyan, di ba? May probable, may suspect. So pag suspect ka, sasabihan ka na kailangan mag-swab.
Pero sir, yun may sintomas.
But that also presumes, and that presumes this is in a community na nagkakaalaman kayo. Diba? But in a gated community, again, this is specific to, let's say, urban poor areas, yung dikit-dikit yung mga bahay. Talagang makakaalaman kayo, wala kayong matatago. Bumahin ka, umubo ka ng umubo, alam ng kapitbahay mo yun, malalaman ng BHW. But what about in gated communities, in places where they have bigger homes, nobody really sees you? Is that a different reality?
Kasi yung mga may symptoms, takot din sila eh. They consult. Wala akong nadinig na case. Sa tagal-tagal nito, wala pa akong nadinig na case na medyo severe yung kanyang kaso na hindi siya nagpa-check. Kasi doon lang sila natatakot eh. Pag nagkaroon sila ng symptoms eh. That's what really scares them. Pag nagkaroon sila ng symptoms, yan, magpapanik na sila. Tatawag ka agad sila sa doktor.
Sir, I'm curious how Navotas is able to afford not having any home quarantine. Kasi when we were talking to Usec Vergeire, ang concern nila, kung tanggalin yung home quarantine, baka hindi makaya baka hindi kaya ng infrastructure, ng personnel, and so on down the line, and ng funding, and so on down the line. That's their concern. Kaya you're going slow on banning home quarantine. How was Navotas able to do it?
Tulungan lang naman yan eh. Tulungan between the national government and the local government. Pag napupuno yung local isolation facility namin, tinutulungan kami ng national government sa isolation facility. Of course, hindi namin kakayanin on our own because we have built twice the capacity that was recommended by DOH. Ang sabi ng DOH, for Navotas, 100 beds lang ang kailangan yung isolation facility. Nagtayo kami ng additional 110 beds para 100% over 210 beds, kinapos pa rin kami. Ngayon, nagtatayo tayo with the help of DPWH, nagtatayo tayo ng extra 150 beds. Yun namang pag sumusobra doon, tinatawagan lang namin yung Oplan Kalinga and they provide hotel rooms.
Mayor, kumusta na kayo dyan? After you were successfully able to bring down the number of positives by something like 45%.
No, not 45. Iba kasi yung kasing 40 plus 46%, yung minus 46%, there is a medical explanation yung DH doon. I cannot explain it. So I don't want to. They say we've brought down the cases by 46%, but I cannot explain it in medical terms, and I cannot even explain it in layman's terms, no, because it's a medical explanation. Yung simpleng explanation na lang is we brought down the positivity rate by 10% from 25 to 15. Pero yung sa DOH, ang explanation nila dyan is yung growth yata yan eh. The minus 46 is a negative 46 growth rate. Pero hindi ko ma-explain in ano eh. Ano, Ed?
Yung bilis?
Deceleration.
Yes. Pero sorry,
the trend is slowing down.
Yes.
Sorry, hindi ko alam explain yun sa totoo lang.
Parang GNP at GDP. Parang GDP.
But in the meantime, without...
So, ang question ko is now na nag-GCQ, how are you doing?
Hindi, talagang kinakabahan kami, no? Because ang problema is from 15, kahit anong tulak namin, parang may resistance doon eh. Parang ayaw bumaba sa 15 kahit anong tulak namin. In fact, di ba, ang ginagawa na namin is we're trying to test everyone. Nung una, prioritize namin, alam niyo naman yan, PUJ driver, tricycle driver, pedicab driver. Ngayon, prioritize naman namin lahat ng mga nasa palengke, lahat ng mga nasa grocery. Tinetest namin yan kahit hindi sila close contact, kahit hindi sila symptomatic, no? Para lang hanapin talaga. Pero mukhang ayaw bumaba eh. And kanina may pinag-uusapan kayo, yung building nyo, meron kaming housing building na close down because madaming cases. So doon sa housing building na yon, local housing building, we will test all the residents there.
Ganon.
Yes.
I think may 26 na positive.
Hindi bumababa. You're saying hanggang 15 lang siya. Hindi
I think
bumababa.
hindi namin mapababa. No, we're trying to push it down. Pero in the last 2 weeks, nasa 15 siya. So hindi namin siya mapababa.
Sundan ko lang, Mayor, yung tanong ni Luchi. Sundutin ko lang ng konti. Are you saying na it's still too early to tell the impact of GCQ to our LGUs? Hindi pa natin
In my opinion, yes. No, I'm not a doctor, but syempre pag lumabas na tao, mas malaki yung tsansa na dadami mahawa, no? Of course, we hope na natuto na sila na yung mga information campaign of proper wearing of face mask, social distancing, hand washing, makatulong. But in most cases, kasi it's really still the same case. It's still within the household. It's when you let your guard down. It's when you go home, you talk to your family, isip mo, lahat naman kami dito responsable, hindi naman kami nagtatanggal ng mask sa labas, so lahat kami dito, walang negative sa amin, biglang nagkwentuhan kayo, yung pala isa positive, yung buong bahay hawa na. Ganun naman lagi until now. Until now, that is the case.
So, Mayor, anong plano nyo ngayon, Mayor? Tinanong ko na rin to kanina kay Usec eh. Anong plano nyo sa paglapit ng undas? Kasi yung ibang mayors ng Metro Manila, they're planning to shut down all their cemeteries during the holidays. Kayo ganun din ba o meron kayong alternative na plano?
No, walang choice naman dun eh. Walang choice. That's the only way. That's the only thing to do. In fact, nag-survey yung MMDA sa Metro Manila mayors.
Yes.
Wala naman nag-no eh. Siguro yung iba hindi pa sumasagot, but everyone who replied said yes, they agree.
Pero meron kayo staggered visiting days? Ganun ba gagawin? Kasi yung iba, hindi daw nila mapipigilan yung mga tao na magsipunta sa cemetery at different days. Paano kayo?
Yan yung iniisip namin. Yan yung hindi pa namin ma-finalize, no? Because what do? You allow, magbibigay ka ng from today, time slot, pa-reserve na kayo.
Alphabetical na po niya.
Okay, coding pa po.
Yung unang nag-iisip talaga kami ng way, no? Paano gawin yan. But every day...
Pumunta eh. Nakita nyo, yung mga tao nag-umpisa na pumunta ngayon eh. Paano gagawin yung...
Yes, but that's mas okay naman yun kaysa pupunta lahat sila sa November 1, no? Ang problema is, when we start meeting at 6, naka-agenda yan, biglang mauubos yung time lang hanggang 8:39 because of... kasi doon sa amin, pag nag-contact tracing, it's not numbers, it's names. So I asked the barangay captain, bakit si ganito hindi mo dinala? Bakit si ganito hindi mo dinala? Isa-isa ko yan. Pangalan yan, hindi yung, bakit yung 9 na tao hindi mo dinala? Hindi ganon. They have to answer bakit hindi mo nadala si ganyan. Hindi, nagpa-test na ho kasi sa ibang lab. O dapat bukas pakita mo sa amin yung test niya. Kung hindi niya mapakita yung test, we will bring him. Ganyan eh. Ganyan kabusisi yun eh. Kaya hindi talaga namin ma-finalize yung pag-isipan natin mabuti. May suggestion ba kayo paano gagawin?
Yun, alphabetical. Ewan ko.
I-coding na lang doon sa last digit ng taon.
Hindi kasi we welcome all suggestions because hindi naman pwedeng lahat manggaling sa amin yung mga idea, no? Minsan mas nanggagaling sa mga mamamayan. Kung ano ba talaga mas mabuti doon sa pagpunta sa...
Ayun, sabi ni Ed, kung anong year daw yung kamatayan, yun yung different day.
Ang dami kaya
Last digit.
But a serious question, Mayor, kasi ako wala akong sagot. Ako wala akong suggestion. But serious question. We know that culturally this is very important to Filipinos. We also know this is the most serious health crisis we have ever faced. Is an option to just no, wala, shut down. Sorry po. For 2020, magdasal na kayo, sorry na kayo sa mga bibisitahin natin dahil wala kaming papabisitahin. Is that an option?
Ay, hindi naman po pwede forever sarado yung cemetery, di ba? Ibig sabihin, tama na nga yung proposal na during those 3 days. But kasi pwede naman, pwede namang ngayon magpunta sila, no? Kasi kahit ako, minsan pag sobrang, di ba there are times na ang init, di ba? Tapos ang sikip. There are times na hindi ako pumupunta ng November 1 eh. Natatandaan ko, pumupunta ako November 2, November 3. Ako mismo parang wala talagang tao. Ako lang mag-isa na handon. Ang bilis.
Pero marami-rami pa rin yun, Mayor. Marami-rami pa rin yun in 3 days. Ang dami pa rin tao nun.
No. I mean, yun na nga. Kunyari, from now until from now, paano natin ililimit, di ba? Yun ang real question and that is the real challenge.
Mayor, baka it's about time that people think this obsession with these dates. Kasi to God it doesn't matter if you visit on November 1 or September 1. Di ba?
Kultura.
Holiday kasi.
Konti na yun, nawala na yun.
Ang hirap
Holiday yun
yan.
Because taon pumupunta dyan at kahit nung bata ako, sumasama ako sa
Over the years na bawasan na yan eh.
Mayor, naalala ko pala po, isa pang mahalagang appointment o isa pang date, naalala ko because we just did it last week. Start na ng voter registration, open na po. Are you anticipating any problems or any complications there? Ano pa ba si Mayor?
Wala raw eh.
Wala na yata.
Mayor.
Nawala si Mayor.
May ginalaw siya dun sa gadget niya, nawala siya.
Pero kasi tama si Ami.
Sorry.
You can visit any day of the year. Why insist on November 1?
Cover na lang. Ayan na si Mayor ulit. Ayan na si Mayor.
Napansin ko over the years, kumukonti na yung pumupunta dyan eh. It's not as much as it used to be.
I agree.
Kasi dati, because of because of internet, because of social media, dati, kasi dati, nung bata kami, when I was young, parang doon ka na makikipagkita sa mga kamag-anak mo, kung may mga kaibigan ka, doon na rin kayo magkita-kita, di ba? May internet na, nababawasan na yung nagpupunta doon. Pero madami pa din.
Marami pa rin.
Mayor, babalikan ko lang po yung tanong ko. Ito, hindi na to sa araw ng patay. Voter registration, we know that there was that discussion pa. Some mayors were saying, i-move pa natin to January again. Pero nagbukas, I know this because I brought my kids to register. Siguro similar din sa mas mabuti na yung umpisahan mo na ngayon, mag-register na habang walang tao. But are you anticipating any complications with voter registration?
There is that worry, nahandun yung pangamba. But it's something we cannot do anything about. Because tingnan mo, kung iusod mo, hindi naman uusod yung deadline eh. So the same number of people for a shorter number of time. Actually, ako yung isa sa mga concern dyan. Ang concern ko lang naman doon sa voter registration, dalawa. Of course, yung social distancing, nababantayan naman natin eh. But they have to remove their face mask for the photo and they have to put their finger for the biometrics.
That's right.
So doon ako worried. So nung una, parang iniisip ko rin na baka mas maganda i-postpone. Ang problema, same number of voters, you cannot move the end period of registration because that is fixed. So, same number of voters, shorter number of time, baka mas malaking problema later on. So parang doon, forced to good tayo. No choice tayo doon. Wala tayong magagawa doon eh. I mean, it's a difficult situation, but it's going to be a harder situation if you give a shorter time with the same number of people, di ba? Parang wala. So siguraduhin na lang na malinis malinis yung pinagbabiometricsan. Tapos siguro dapat mabilis lang talaga yung photo. Di ko alam eh. Walang ibang choice doon eh. Na taon kasi na mag-eleksyon eh.
Okay.
I mean, kung hindi election year yung 2022, kung hindi election year yung 2022, Ed, sa tingin ko wala masyadong issue eh. Di ba? Because ito yung hanggang September lang ang registration dyan eh. Di ba? All new voters, lalo na presidential election yan, alam mo naman mas mataas yung turnout pag presidential eh, di ba? So, mas madaming gusto magano. So, yun, wala talaga tayong magagawa. Though, kabado talaga kami doon. At mas kakabahan kami towards the end kasi kahit gaano kahaba yan, ang daming nagka-cram dyan sa huli. Pero maganda rin naman yung ginawa ng COMELEC kasi may slots yan eh. Hindi na katulad dati na unlimited eh. May parang scheduling silang ginawa. Tsaka hindi na sila naglagay ng, I don't know if it's good or not na wala ng satellite, no? Pero may scheduling yan for sure. Hindi na pwedeng basta pupunta ka doon, pag puno na, hindi na pwede for that day. And you have to print out your forms in advance. So may ginawa rin naman yung COMELEC. Maganda rin naman yung ginawa ng COMELEC. I think they're trying their best.
Alright. Maraming salamat, Mayor.
Yes, thank you. Stay safe.
Mayor. Maraming salamat.
Okay, Mayor Toby Tiangco, sir.
Sunod natin
Thank you, sir.
pag-isipan kung paano naman yung Pasko tsaka bagong taon.
Oo nga, sir. Nandiyan na si Jose Marichan eh.
Hindi, kasi di ba? Undas eh. Susunod doon, Pasko na tsaka bagong taon. Isipin na natin paano gagawin natin doon.
Okay.
Okay.
Sir, maraming salamat po.
Okay, salamat po.
Thank you.
Thank you, sir.
Isipin niyo na raw yung pamasko niyo.
Last digit na
Isipin niyo na raw, reminder, nagpapasko na, Lucy, Ami. So, ayan maganda na kayo.
I-email namin sa iyo yung regalo namin. Work from home, di ba? Di send from home din. Okay. And that will be all for this edition of the Chiefs. We hope to discuss it. We'll keep the conversation going. I'm Adling of One News.
I'm Ami Pamintuan of the Philippine Star.
I'm Lucien Cruz Valdez of News 5.
I'm Robbie Alampay and we are One News.